Hi, on this episode of Me, You, and Who, I got a chance to speak with Leslie Murphy. She is a licensed clinical social worker with over 30 years of experience. She is trained in all aspects of psychotherapy, but Leslie has a unique specialization in women's health, including infertility, reproductive loss, family building, high risk pregnancy, postpartum disorders, etc. And she is actually someone who I work with as a coordinator. And I was also lucky enough to have her be the psychologist who did my evaluation when I was a surrogate. It was a joy to talk with Leslie. In this episode, we got a lot into the the psychological evaluation, that step that's really whenever you are moving forward with a gestational carrier. So it was just a true joy speaking with Leslie, and it was so fun to get her perspective and hear about just the importance of mental health when you are moving forward in this. So please enjoy Leslie Murphy. Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. You gorgeous angel, Leslie Murphy. Oh my gosh, you know how much I love and adore you. You have been a psychotherapist and a director at it is now Memorial Wellness and Counseling here in Houston, Texas. What you specialize in reproductive health. So what exactly does that mean?
What does that mean?
What does that mean?
Well, that's a great question. Well, it really falls under just the whole idea of women's health.
Yeah.
And so it's just more of a specialization, reproductive health, meaning more inclusive of infertility, pregnancy loss, high risk pregnancy, postpartum, all of that. And so there is a specialty through ASRM, which is the American Society of Reproductive Medicine.
Right.
There is this amazing group called the Mental Health Professional Group. And it's such a great connection every year at conferences, but that we have evolved or they've evolved, gosh, over the last 20 years. And there's now actually in services and education specifically for therapists to participate in so that they kind of meet the criteria to serve as a reproductive health counselor.
Okay. So what exactly, when you first went on the journey of wanting to become a psychologist,
Yes.
what drew you to women's health?
So, gosh, that's a good question. So I worked primarily, I started off doing a lot of grief and loss, and I worked at Methodist Hospital. I worked at MD Anderson, I worked at Methodist Hospital, and then I made a switch and then ended up at Women's Hospital. Had no idea, truly just the passion that I had then for working with mamas and babies and all of that. And so it was just kind of a universe thing. It was just perfect timing. And I'll date myself, but that was back in the late 90s. And being at a women's hospital was such a great kind of stepping stone to get into more of the specialty because you're working with all of it. You're working with everything from teen moms to adoption to, fetal demises, full term to miscarriage to termination to just all of it. And so you're
Yeah.
seeing all walks of life, all different areas for women that are affected in so many ways. And so just really having a passion for that and loving that. And then I shared openly that my husband and I have our own fertility journey. And during that time, feeling somewhat alone and isolated, and really looking back after we finally were successful and thinking, I want to do that for someone. I want to be that person or provide that support. And so I went back to one of the fertility clinics and met with them, and we came up with this great proposal. And then I became kind of their point person and started doing, again, reproductive health.
Sure.
So I'm a clinical social worker and psychotherapist. And so I do everything from stress management to grief and loss, help with decision making, some conflict resolution, especially with couples who are trying to make that decision.
Yeah.
And then that also moves into the area, of course, with fertility and a third party. So, of course, a lot of sperm donation, egg donation, embryo donation, and of course, surrogacy.
Sure.
Yeah.
Sure. So you dated yourself? You dated yourself a little bit. How has the world of all of that changed from going back to not way back.
Yeah.
But you've been in it for a period of time, and just the world of infertility has evolved so much since then.
So much so.
Oh my gosh. So how was it?
Biggest change, which I of course see is very positive, is just the openness of people.
Sure.
The fact that we're doing a podcast on this, the fact that people are talking, the fact that there's so much on the internet and social media, and how open people are with their stories.
Yeah.
I think that has been the biggest change and has been a blessing to so many because they don't feel so alone. And so I think that part has been the biggest change, and just more of an acceptance and less judgmental and more openness, if that makes sense.
No, absolutely.
Yeah.
Absolutely. So specifically speaking in terms of third party, when you began everything, how were you shocked by the third party aspect of it? Was that something that you were mostly working with, infant loss and kind of, I shouldn't say typical, but a lot of kind of what people might think whenever they're thinking of infertility, and then all of a sudden there's this third party piece.
Right.
Yeah.
Well, and that's so much more prevalent. It's so much more available.
Yeah.
It's so much more widely used, maybe widely accepted. And so I think that part has changed. I don't know about being shocked, but more about just how educated consumers and intended parents are, where before it would be, oh, my OB said to go to this doctor, and then this doctor said I need to do this, and there's we're gonna use this one agency. And now what I see is that this educated consumer who is going to talk to her girlfriends, and she's going to get online, and he's going to do this and this, and so it's really exploring, and them coming back and saying, well, wait, doctor, have we run this test yet? My friend did this. And so there's a lot of that, but I think there's a lot of sharing and talking, which can be good. But it also, Dr. Google isn't.
Oh yes, we stay away from Dr. Google.
I think there's a sweet spot there.
Yeah, absolutely.
I think the other biggest thing we see as far as third party is really we focus a lot about disclosure. So disclosure mostly to offspring and disclosure to the kids involved.
Sure. And
helping them to understand. So their donor conceived through egg or sperm or embryo, that of course we are, I think that we've come full circle as far as mental health. And I see that with the physicians too, just such a support and encouragement of being open. You hear the term early and often, which means, hey, this is just part of their story.
Yeah.
Let them hear it early, let them hear it often. And when I started in this field, we used to have to go to special publishing companies to order books or to give these resources.
Mhm.
And now you go to Amazon and you click in
Absolutely.
surrogacy books kids, sperm donor books kids, and it's just just a list, which is amazing. And there's new ones every day.
Yeah.
And so again, that normalization
Mhm.
for parents who don't feel like, is my kid gonna be the only one or made fun of? And that used to be the biggest fear.
Mm.
And so even if we have someone who starts off with, well, I'm not quite sure we're gonna tell. Why would we tell? And when we talk about the benefits and the risks, most of them by the end of the session will come back and say, that makes sense. Or
Yeah.
because we're looking at what's best for the child, not what's easiest really for the parent or for the donor. So anyway, I don't know if that answered your question.
No, absolutely, absolutely. So going back to part of third party, everyone focuses a lot on the medical screening appointment, right? Everyone wants to make sure that it's a healthy body that can carry a pregnancy. That's huge. That's what a lot of people focus on, and it almost feels as though the psychological, it's required by clinics, reputable clinics, that there's a psychological evaluation for intended parents, for a egg donor, or for a gestational carrier.
Right.
And obviously for the gestational carrier, it's a little more in depth because you're about to go in a relationship with these intended parents. It's not anonymous, although, egg donation is becoming less and less anonymous. Anonymous is very in quotes.
Right.
Anonymous.
Yeah.
But that psychological aspect, I feel as though it is just as important, if not more, and it should not be observed as checking a box.
Yeah. All right. Oh, let me just kind of check the box and go through and, I need to schedule this just because I need to get it out of the way.
Exactly.
Right.
Exactly.
Yeah.
What makes those meetings, those evaluations so important to this process?
Well, I don't love the word evaluation.
Okay.
What it is,
Uh-huh.
in essence. But I think that term, it feels judgy. It feels,
Ooh, I love that. Okay,
right.
good.
It feels like you're evaluating my ability to carry a child,
Okay.
to participate. And so I always like to start with that and just kind of not really rename it, but really talk more about what is the purpose of that session. So a lot of times you'll hear, so let me back up. So
Yeah.
if we have an intended parent to define that as just a parent, a single parent, a same-sex parent, a couple, a heterosexual couple, who are presenting and needing the use of either an egg donor and surrogate, or a surrogate, which is also, as you know, gestational carrier. And so for them, we typically are using the word consult. So we might use the phrase a psychosocial consult or psychoeducational consult, psychological consult. So you hear the word consult where it's more of a educational / counseling session. And that feels and is different than an evaluative session, which is what you're doing with our surrogate. Now, you mentioned earlier about different clinics requiring different things. And so we see that. We have different clinics that may have a different requirement for, this is their second round, they don't need to do that, or we need to do the same thing, we're going to go by the book. So it really depends. But what we look at is best practices.
Sure.
And so again, ASRM has guidelines and recommendations. And so they have guidelines or recommendations that they recommend 3 sessions. One is going to be that intended parent consult or educational session. The second is going to be the gestational carrier with her partner or spouse, if she's partnered, and that's going to be the psychological evaluation. And then the third session is what we call the joint session.
Right.
And we can talk about that. So typically it's 3 sessions. The reason that, well, all of them are important, but I'll start with the IP session. So I think a lot of IPs may come in at the very beginning, or more like, oh, I haven't done this yet, I need to do the checklist. It's so helpful if they can not view it as part of the checklist, if they can view it as part of the beginning of their treatment as of their journey, and they can do that counseling session initially, I find it's helpful with the match. I find it's helpful for them to really process and think through what is best for them as far as being matched and emotionally. And so when I meet with an intended parent, we typically have, certain issues, things that I want to make sure to cover, to make sure that they are informed, that they are prepared, all of those things, right?
Yeah.
And so I start with just hearing their journey, and they all have some sort of story, always. And a lot of times it's been very difficult.
Mhm.
And so I usually like to just kind of check in with how are they doing? How are they, if they've had, a hysterectomy, they haven't had a child yet. How are they coping with that? Have they
Mhm.
dealt with the grief and the loss of that?
Mhm.
If they've had a healthy child and a healthy pregnancy, then they lost the ability to carry, or they don't really know why they need a surrogate, but that's kind of the next step.
Mhm.
So we really like to explore and talk through just the emotions around kind of letting go of them.
Absolutely. Yeah.
I often refer to something called the grief relief ratio, which is this idea of I'm grieving the loss of caring, but I'm relieved that I'm not caring, or that I don't have to, or that someone else will, or that I have found someone that will.
Mhm.
So many of those, especially intended moms, will say, yes, I totally get that.
Mhm.
I'm sad it's not me, but oh my gosh, I might be able to enjoy this journey.
Yeah.
I'm not going to be so anxious. And a lot of times the intended dads will feel a lot of that relief. They've watched their wife struggle emotionally or physically. They've watched her have a traumatic birth or whatever that is. And so they feel some relief that they won't have to worry about something happening to their wife.
Yeah. Oh gosh, yeah.
Yeah. So we talk about just the emotions. We talk about the grief of not caring, and what would help them to feel as much a part of that journey as they want to.
Mhm.
And we talk a little bit about sharing with others. Many of the intended parents will say, we have been through so much. We're keeping this a little close to the chest. We're not going to share this with everyone because our parents have already been through so much.
Mm.
Or everyone will drive us crazy with all their questions.
Sure.
Right?
Very fair.
But so there's a sense of protection of one, their own heart, and two, of their families and what they're going. So we'll see a lot of times where they may say, well, our families know we might, or we've told our best friends, but not my mom. So that's real common. So then we talk about what does that look like, and they'll often say something like, when I feel safe.
Mm.
What is that?
Yeah.
Pregnancy test, 20 weeks. I've had women sit here at 28 weeks and say, okay, I think I'm ready to tell people. So it's really, everyone's so different, and taking pressure off that they have to be excited about it. So we talk about sharing. And then we talk a lot about decision-making and preferences. If they're already matched when they come in, then we talk about what was important for them in matching with their surrogate, and what are their preferences for involvement, expectations, all of that throughout the time in getting to delivery. And then a little bit more about expectations of the relationship with the surrogate, the communication level, involvement at appointments,
Mhm.
More decision making around everything from termination to selective reduction to how many embryos to transfer to, can she have one caffeine a day? All of that. So that is a lot about our session with the intended parent.
Sure.
Yeah.
Sure. Is there anything, as far as the intended parent is concerned, what is a way that the clinic and the agency can be helpful on the front end and maybe throughout the journey when it comes to that psychological aspect, which I feel like is so key in relationship building when it comes to especially an intended parent with a gestational carrier.
Okay, so maybe two things. One is if they can really encourage the role of a counselor or the therapist or that session early on.
Yeah.
I think that's one that might be helpful. And two, I see a lot of times the agencies doing a lot of surrogate Facebook groups and surrogate together, helping them feel that they're not alone and they have a group. And I don't see as much of that, most likely due to HIPAA, or they live all over the state or across states. I don't see as much of that from the agencies or the clinics of really connecting intended parents with each other. And it's such a specific. So I run a support group, have for 15 years monthly. We're finally back in person. And it's an open group. It's for anyone who's using a sperm donor, or she's doing an IUI for the first time, or you name it.
It's there.
It's there. And so at our last session, there was only one who was using a surrogate. And so I think that while she felt a part of it, I think to have someone who is going through that experience, I think is really powerful. So I think that might be another thing, is really focusing on helping connect these intended parents, whether it's the parents. I don't want to leave out those partners.
No, of course.
But for those intended moms, maybe somebody.
That's interesting. So our agency we have those Facebook groups.
Yeah.
So we have, with the surrogates, we have the Facebook group, and it is Wednesday's bump day. We got photos going, and happy transfer day, and asking questions. And we have one for the intended parents, but it's not super active.
Okay.
And I wonder, do you feel like maybe despite how far we've come, it still is not taboo's not the right word, but I think people are still they're still struggling in some way, shape, or form, whether it's shame or just every journey's different, or I don't know how you would make that more active.
I don't know. I think that a lot of intended parents will say, either during or after, it was a very surreal process. So it's almost like, I know it's happening.
Sure.
Picked my surrogate. We are pregnant. But even for them to say out loud, we're pregnant or we're expecting, there's also a big sense of, I don't want to put it out there yet.
Yeah.
And so maybe coming to a Facebook group or being a part of that makes it real, and they're not ready.
That's interesting.
I don't know.
That's interesting.
I don't know.
Yeah.
But I've got several right now who, it's interesting. I have several right now who are using both an egg donor and a surrogate. And so that's even, for those women, sometimes even feeling even another sense of removal.
Sure.
Or worry about connection. And so in talking with them, I just happen to have several kind of at the same stage right now. They're very open to meeting. So I don't know. We'll see.
It's almost like you almost need to do like a dating profile and almost like match people.
Absolutely. It is. And a lot will come in and say, oh, I've reached out to my friend's friend. She is a surrogate 5 years ago. And so she was really helpful. So sometimes they do that, but that person's moved on and they've got they're into soccer now. They're in.
Oh yeah. Yeah. Well, and I mean, I feel like the journey changes so much year to year.
Yes.
Like just the clinic themselves change from year to year, and your experience with 2 years ago is going to be totally different from my experience right now.
Yes, absolutely.
Yeah. Okay, so what about the gestational carrier?
So I think So what, the importance of
The importance of, yes. So, again, just going back to, I, as a coordinator, a lot of times those GCs are, okay, when's my medical screening appointment? Because I know that's the one that check, let's go.
Right.
And so I'm always, one of the biggest things I'm like, well, we have to do this part in order to get, it's very step by step, and it is very important. I think for me as a coordinator, of course, we want to make sure that the woman themselves is ready and fully understands what's about to happen.
Sure.
But then I think long term, I know as a coordinator, I'm looking at this is the stepping stone for this relationship that you guys are about to build.
Absolutely. So I think when it comes to the evaluation, one is I would love to say to all the potential surrogates, come into this session with but being open and forthcoming, but also more of this can be helpful.
Yeah.
Like instead of a check the box, I have to do this thing and answer these questions and take this long personality step questionnaire assessment. Just what can I get from this? How will this help me be more successful? And so when I say successful, of course, I hope that means a healthy baby. But to me, successful means they have shared their expectations with each other, meaning both parties. They are communicating openly. So they know what's expected. They feel comfortable with each other. So that's what I mean by successful. And so you're right, the stepping stone. Part of the evaluation is okay, informed consent. Does this surrogate and her partner, so we require husbands, partners to be there as well, because this affects him or her, she has a female partner. But I think really looking at, do they understand, most surrogates, let's face it, they've had easy breezy. They've had, or they wouldn't be here. They've had easy pregnancies or deliveries, or they've enjoyed their time being pregnant, or, and so we want to look at that motivation for why they're here, but we also want to, not to be negative and Debbie Downer, but it may not be as easy as yours were with your first two children.
Absolutely.
Right. And so I always like to couch it with that. Like, look, we are not trying to be negative, but we want to help you prepare. And for me, that is part of, or really an important part of the evaluation is how do we help the surrogate or the carrier feel prepared emotionally for this journey for the next year and beyond, but at least for the next year. So when we're looking at informed consent, does she understand she might have a C-section? She might be on bed rest. What does bed rest mean? That means you're not driving your kid to school or giving a bath or going to HEB. What does that look like? You have a husband that works full time. He can't just take off. So who in the family might be able to help? What kind of after school program is there? So just allowing them to begin thinking about that. These are all things that are going to be in the legal contract. So it's also really nice that these sessions to talk through the decision making and things that may come up, because they're going to have to really further make some hard decisions and have that in the legal contract. So that can be helpful if they come in going, this is helpful. I'm going to talk about this and I'm going to feel better. And of course, there might be something that comes up and, we'll talk about that. But basically, we're wanting to make sure they're informed. We want to make sure that they are at a good place to make this decision.
Yeah.
And when I say stability, that means a lot of different things. Did they just lose a parent in the last 2 months? Are they newly divorced? Are they having some marital problems? Was their kid recently struggling with something? So they might be the most wonderful, attentive, loving, nurturing person, but with these different life events that might be happening around them, may not be the best time. Doesn't mean they can't come back in 6 months or next year. So we really look at that stability piece, right? What would be something that might affect not just their ability to carry, but them?
Yeah.
So I think it's important that they understand we're looking at this of what's in their best interest. Sure, we want to help these intended parents have a healthy baby, but more so, we want to make sure this isn't going to be a detriment or a stressor to affect them or their family.
Yeah,
Okay.
absolutely.
So we look at that, we look at their motivation. Why are they here? What prompted them to reach out to Surrogate Solutions, or what prompted them to call? Is it, oh, my mother went through something, or I had a miscarriage and I never thought, oh my, how important that was until I went through that, or I'd love being pregnant, but I, don't really want more kids, but I want to get this. And so we really, talk a lot about their motivation. We really have that partner there to make sure that, is he on board? Did he want another kid and she didn't? And maybe he's a little, we want to give him a chance to talk through some of that.
Yeah.
So again, just having this very positive, stable place for them to kind of start this journey.
Sure.
We, of course, are going to look at any postpartum history, her mental health history. Not as worried about the genetic component. She's not passing that along, but we're looking at what has she been through? Has she worked through that? Has there been some abuse or sexual assault or something that, we haven't unearthed and that hasn't come out, and that we might need to kind of recover that and explore and talk through that, work through that. Again, not putting her at risk. I like to look at what are her strengths. A lot of our surrogates are, they're really strong women. So we don't really doubt that. So we look at, okay, what helped you get through COVID? What helped you get through your kid's diagnosis or your first divorce? Or maybe they didn't have the most stable family growing up. How did they grow from that? How did that help them pick a different partner? So some of that. So really kind of exploring some of that. And so if they say, well, we've had counseling, that's great.
Yeah.
I think sometimes they're a little worried coming into the session, like kind of that judgy, like, am I going to be judged that, my mother was an alcoholic, or I've divorced, or I'm single, or, and so there's not ever a judginess. It's more about, is this a good time? Are you able to commit?
Yeah.
Will this be more of a benefit than a risk to you and your family? So we talk about a lot of that. We make sure we also do a personality assessment. And you may have therapists that use the PAI or the MMPI-2 or MMPI-RF, different versions. So a lot of people are like, what is this? What is this? Personality test.
I remember sitting there, looking through everything and thinking, like, I think this is the test that will make me go crazy.
Yeah. And I often get, after they finish, did I pass?
Interesting.
Am I crazy?
Am I crazy?
Yeah. Everyone likes to joke around. So again, we're not looking for crazy. We're not looking for pass fail. We're looking for what other information can we obtain from this assessment that helps us look at how this surrogate, how her mind works, how what she's thinking, how she approaches life. What are some potential struggles, whether that's addiction issues? Is she overcommitted to things? Is she struggling with some anxiety? Is there really some really low self-esteem? Does she tend to hold things in until she explodes? She's passive aggressive. Is she quick to anger? So again, nothing's judgy, but we can look at that and say, hey, your assessment says that you tend to kind of push things down. So let's talk about that.
Yeah.
If you tend to do that, if you're aware of that, as you move forward this process, we need you to be upfront. If there's something bothering you, or you feel you need more support, or your nurse isn't calling you back, or whatever that is, we need you to not keep things in. We need you to call your coordinator. your counselor. You need to talk openly with, with your intended parent. So we kind of use it for that.
Sure.
If there's something that is more alarming or a concern, then of course we're going to come back and talk with them about that. And
Yeah.
so that's a little bit about both of those together. And then so typically once we complete that assessment and complete the interview with both her and her partner, then we schedule our joint session. Joint session. I mean, I've seen everything.
I bet you got stories.
We went camping together last weekend, or they've never met in person until they come into the session. I think with COVID, we're just seeing more and more people who are connecting on Zoom and telehealth. It just becomes more normal and natural. So I'll have couples that even though they might live in Houston, they've only connected through Zoom.
Sure.
And so it might be their first time to come in person.
Yeah.
I think it's really, I know it can't always be the case, but I think it's really important that they connect in person before the transfer. That can't always happen, but that's kind of a goal, I think, ideal. And so in that joint session, a couple of goals that we have. One is that we want to just have very, very clear expectations. So if the intended mother expects that the surrogate is not going to drink more than 1 Coke a day, and I know I'm just pulling out.
Yeah, no, let's do it.
Came up recently, and she can't assume that the surrogate is that. She has to be very clear about, hey, this is something that's important to me. Can we talk about that? So what I tend to see a lot of times is that you've got this match and these women are meeting for the first time or they've met and they are both not wanting to bother the other. I don't want to ask her that. That's too much. Or I don't want to, gosh, that couple, they've been through so much. I don't want to put this on them. And I think that's lovely, but that doesn't work. And so I will often bring up, let's talk about some difficult things. How would you both? So again, not being negative, but let's talk about bed rest. Let's talk about some of the decisions around termination. And nobody wants to talk about that when we're trying to create a life and everyone is so excited about bringing a baby in. But if there's going to be decisions that around a child that is going to suffer or have quality issues or is not expected to survive, those are things we have to kind of talk about beforehand.
Absolutely.
To make sure everyone is respectful or at least on the same page.
Yeah.
And I know you guys do a really good job of that.
Thank you. We try.
You do, because I think people are coming in more educated about what that means.
Yeah.
Of course, we're in Texas. That's a whole
other Roe v. Wade opened up a whole different can of worms.
Okay. But again, so anyway, so we talk about expectations. We talk about clear communication.
Sure.
We talk a lot about the different decisions and comfort level. Are you comfortable with both of the mother and the father being in the room at transfer? Are you comfortable with them both being in there for an ultrasound? And so really talking through each step, we talk about a lot about the surrogate's children and has she shared with them yet? And a lot of them have. They come in and they're so excited and they're like, I've already told my kid. If they're younger, of course, they may not truly get it.
Sure.
But we talk about some ways, and we know that our carriers need to have closure, and typically they get that by seeing the birth and being there and seeing these intended parents experience so much joy. And that is why they're doing it.
Yeah.
So what we find is these kids, especially anywhere from 3 and 4 to 9 and 10, they need that. Mom comes home and there's no baby and they're like, wait. And so sometimes they take a photo together and they show the kid, or they might Zoom together or FaceTime together, and that kid gets to meet, Miss Susie, who is going to be who's the mom of this little baby.
Absolutely.
Right. And so
Yeah.
we talk about the books. And so we really help find ways. One, how do we support the surrogate and her family? And we help this be positive for her. And two, how do we help the intended parents feel as much a part of this journey? If this intended mother would like her mom to come to an ultrasound, if they want to record voices and let that surrogate play the voices, at 20 weeks and beyond, if they want to have the surrogate come to a baby shower, whatever that means.
Sure.
Right? And so just kind of putting all that out there. And then also really going back to the support. If there's something that happens throughout, whether it didn't go as planned.
Yeah.
Life happens, because life right now is crazy in the world. That we have things set up for our surrogate or our intended parent to get counseling or support or whatever that looks like.
Yeah, absolutely. Absolutely. I mean, I know I definitely took advantage of having sessions post pregnancy and, I think even during at some point. But what do you feel like as far as what would be helpful for intended parents and a gestational carrier to know about maybe conflict resolution?
Okay.
Because we're on a long journey.
Yeah.
Even if it's successful the first time, it's still a long journey.
It's still a
and
long
then
journey.
throw in maybe a failed transfer and, just anything.
So I think, and I don't know if this goes to conflict, but something that comes up a lot is, and I had this yesterday with somebody, the surrogate is so excited. Her goal is to get pregnant and help this family create their
Absolutely. Yeah.
So when there is a positive pregnancy test or there is a heartbeat, she's celebrating. She's done her job. She's excited. This is exactly what's going to happen. And sometimes, like we talked about, those intended parents not quite there yet, protected, they are not quite celebrating. They are happy. They want this, but they are so scared. So sometimes it's not really a conflict, but sometimes if we don't address that in the beginning, that surrogate might say, well, gosh, I thought they'd be more excited. Why are they not?
Sure.
And so helping to kind of name that and help them understand that that's normal and expected. And so that doing some little things like that to kind of set the tone helps avoid some of that conflict.
Yeah.
I think it really goes back to expectations too, is if, and you can probably give lots of examples that you've seen, but the little things I can think of is, where they thought, I thought we'd talk more. Or I thought, an idea of what you thought it would be, but you didn't really express that. There was some assumptions. So just being really clear. So I think so let's say it doesn't work like it's supposed to. No one's blaming the surrogate.
No.
She is human. She's a woman, and she will most likely question herself and what did I do and what could have I done? And everyone, the clinic, the agency, the IP is going to say, oh my gosh, it's not your fault. We know that this might just happen.
Right.
But that's where I want the surrogate to use her voice to be able to say, I'm not quite ready to get started. I need another month. Or I'm ready, but the intended parent's not quite ready.
Sure.
So that, again, that mutual respect of I'm ready, but you're not, and let's kind of feel each other out. I think using the agency, it always not makes me nervous, but I love our people to have an agency because the agency is with them. Y'all are with them throughout until delivery and even beyond. And so it's hard when you don't have a third party there to advocate and help. And so I always say, use your agency, use your people, right? And I think that can be really helpful. And so I think it just comes down to communication.
Yeah.
I can remember a couple of years back, we had somebody and they just felt like they weren't conversing as much and
Okay,
and
yeah.
connecting. And it just turned out that the surrogate was having some depression that kind of came out of some stuff that wasn't really related to the pregnancy. And she came in and we kind of did just another joint session. And it and where the intended parents were thinking, is it us? Did we do something? It had nothing to do with that. It was really more of some stuff that she was dealing with. And she started some counseling and yada, yada, yada.
Sure. And it was great.
It was good. And they ended up having, I mean, I think they even did a sibling journey. And so that's when we see the issues, when the communication shuts down.
Yeah.
That's, I think, where there's more of an issue.
Oh gosh, for sure.
Right.
And it's and that group session is so vital to set up
Yeah.
expectations of communication.
Mhm.
Is it text? Is it FaceTime? Is it phone calls? Is it
Mhm.
in person if possible? You know, just all of that.
Yeah.
No, that's fantastic. You've already given so much just fantastic advice. Is there any practical advice that you would give to potential intended parents, a potential gestational carrier?
Um, so a lot of times I'll say there's so much as we talk about looking forward. So
Sure.
I'll often say, okay, we're going to talk about stuff that's going to happen over the next year. When y'all walk out of here, I want you to go back to 1 week at a time.
Yeah.
What's happening this week? Oh, we're done with this. Let's call legal. That's what's happening.
Yep.
Okay, next week, we're doing this. The next week, we're doing this. So, because a lot of the legal and the joint session and everything is about what if this? What if there's a loss? What if there's bed rest?
Yeah,
what
absolutely.
if this? And getting ahead of, we're talking about delivery and we're talking about what breastfeeding. And so let's kind of take it back to let's just go one step at a time. And so that we're not so ahead. So that's one thing. The other thing I see with surrogates, and I just feel like surrogates are such a special breed, I say, just they're not great at taking care of themselves. Because and I don't mean that in a bad way.
No.
They are so much about giving to others, taking care of everyone else. What they're doing, just the act, no matter if it works or not, just the act of love and the act of service and giving. So I often will say to them, you've got to raise your hand. You know, you're not superwoman. No one expects you to do it all. That's why you have intended parents and agency and a partner and therapists and everybody else. So really for them just to recognize, you know, it's okay to ask for help. It doesn't mean you're not strong. And I mean, I could say that to every mother. Right?
Right, exactly.
But I think that is really important. And the other thing with that is intended parents sometimes they like to be helpful.
Yeah.
So if there's something they can do, whether it's anything, a extra housekeeper or sends a meal or an extra phone call or whatever that is, that helps them to feel needed and that I think
and even more part of the process. Yeah.
Right.
Yeah, absolutely.
Yeah.
Absolutely. Well, especially, you know, I think it's so important for a carrier, as you know, if the transfer doesn't work or something like that. I think it's so easy for a lot of our carriers and intended parents to immediately go to, again, that physical aspect. Okay, do we need to do an ERA? Do we need to, what do medications look like? And I mean, you're kind of just going and looking at the physical aspect, and you're not maybe always taking a step back and thinking, I just experienced a loss. And maybe as a carrier, that was your very first loss. And even despite the fact that it's not your baby.
That's right.
Like
they make it just as hard.
Oh gosh, yeah.
Right. And they feel that responsibility, even though no one's putting it, that's just as right. And so, so for them to be able to say, gosh, Whitney, can I talk with you? I'm really struggling.
Yes.
Or I'm not quite ready. Could we wait another month? Or is there someone I can talk to who's been through? Is there another carrier who's had this and then was successful?
Yes.
So I think any of that, just again, where I'm kind of gently pushing surrogates to raise your hand, ask for help, use your resources,
Yeah.
right?
Yeah.
Yeah.
No, definitely. Definitely. Okay, we're gonna have to have a chit chat again some other time because I really want to talk about the egg donation aspect of it, but I know we're running out of time. So I have one last question for you.
Okay.
For anyone who knows me, they know that I have a coffee addiction like no other. And so at the time of recording, if you can see us, I'm holding my cup of coffee.
Yes.
What filled your cup this morning? Whether it's literally or figuratively, what filled your cup this
Oh my
morning?
goodness. Okay. That's funny. It started with some doggy snuggles,
Oh, love a doggy snuggle. What kind of dog do you have?
a big old lab,
Oh,
big old Faith in the
sloppy
morning,
snuggles.
telling me to get up and get her some breakfast. We are sisters. I love my coffee.
Mm-hmm.
I usually have one at home and then I have one here.
Yes.
So that's kind of my thing here at the office. And so I did have 2 cups, but one of the things that fills my cup, and so I have 2 offices. So I have an office here. I didn't really talk about all that, but I have an office here, and then I have an office with CCRM, which is fertility. And the people. So that in between sessions, I can walk down the hall to a nurse over there. I can walk next door and, like I was telling you earlier, I had some kind of heavy clients, heavy sessions today. And so just to be able to have a laugh or to connect and so that absolutely fills my cup.
I love that. I love that.
And my coffee.
And your coffee.
And my coffee.
And your coffee.
Yeah.
Okay, so for people who want to find out more about you, you are Memorial Wellness
and Counseling. I was Leslee Tiller Murphy, LCSW for
forever.
I don't even know how long here. So I'm excited because I've just hired a new associate who is a fertility patient, resolved fertility patient herself, social worker for 15 years. So it's been really great. Adding her name is Kristen Maljon. And so she has joined the practice and is learning all about third party and starting to do. She's not quite doing surrogacy yet, but we're getting there. We're getting there. But Memorial Wellness and Counseling, so memorialwell.com. And
I am so grateful for you.
I love it.
And so grateful for you. I love seeing you too. Yes, for those who don't know, Leslee did my psychological evaluations or psychological assessments or our chit chat when I was being a surrogate. No, it was really lovely. Okay. It was really lovely. You make we did it at CCRM and I remember just like, oh, this couch is so comfy. I'm pretty sure I took my shoes off and just like, and just hung out.
Oh my God, but see, that's what I would want. I want the comfort because I don't want to be yourself.
I'm pretty sure I very much was. I don't think that's shocking to anybody. Well, thank you, Leslee, and I am so grateful for you. So yes, everybody check out Memorial Wellness and Counseling. You have just finished listening to an episode of Me, You, and Who. To find out more about egg donor and surrogate solutions, go to www.createahappyfamily.com.